Hi, good morning Marvin. My name is Mihiraa. I'm your invigilator for the OIT speaking session on the 9th of January 2022. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Marvin.
And what is your candidate number, please?
My candidate number is 212237442.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure, here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right, Mihiraa.
How do you practice self-care?
The job of a nurse is very challenging. Along with the emotional pressure, there may be some other issues, such as job timing, night shift, etc. So, we have to be fit and fine for this job to be available all the time. That's why I exercise and meditate daily. Along with this, I have some stress-busting hobbies, such as gardening and cooking. These all help me a lot.
How do you respond when your friends ask for your diagnosis outside of the clinical setting?
I have faced these types of situations many times. I have a family friend who would ask me about the symptoms he was having and what I thought he should do. I told him clearly that I could not give him a diagnosis outside of the clinic where I worked. He finally made an appointment to see the doctor. It is always the best practice to treat patients in a holistic, professional manner, so we have all the right information to do what is best for them.
What do you think about effective patient and family education?
Effective patient education is needed to satisfy the patients and their families. Every patient has their own learning style. So, we have to understand their learning style and adapt accordingly. So, we have to figure out what each patient needs. It is very important to include the family in the treatment process, because they are the main caretakers for the patient in the future. So, it is our duty to explain to them the process and tell them how they can help the patient.
What are your strengths as a nurse and why?
My biggest strengths are my compassion and my ability to solve complex problems. In my previous job, an older man came to the hospital that had night terrors. He would wake up screaming every few hours. I took some time to talk to him. I quickly found that just 10 minutes of conversation took away his fear. His night terrors left, and the other patients on the ward could sleep peacefully again.
What is your most incredible skill as a nurse?
I think my most significant ability is to listen to what a patient tells me. From a patient's perspective, it is very frustrating that no one hears you. I have spent 5 years in the medical field working directly with patients and find that active listening can go in helping make someone comfortable. As a result, I was appointed as a trainer for a patient advocacy program to teach other nurses.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, I am good, Mihiraa.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role-playing card if you want to. Here's a pencil for making notes.
Thank you, Mihiraa.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Hello. Good morning, Mihiraa. Good to see you again. I am Marvin, your attending nurse here today. How are you doing?
Good morning, nurse. I am doing great. Thank you for asking.
Good to hear that. Well, I am here to remove your stitches. Afterwards, I will clean your wound and redress it.
All right, nurse.
Before we start, may I know, do you have any concerns, please?
Yes, nurse. During consultation, the doctor told me that I have something called squamous cell carcinoma, which I think is just another name for skin cancer. So, I am really worried.
Your concern is understandable. For your better understanding, I will explain it to you.
Okay. That will be of great help, nurse.
Mihiraa, squamous cell carcinoma of the skin refers to a type of cancer that forms in the squamous cells, which make up the middle and outer layers of the skin.
Oh, I see.
Even though there are many treatment options available for squamous cell carcinoma, the best method is surgery. Now, Mihiraa, you can be left off your worries, as you have already undergone the surgery. I can assure you that the surgery helped to remove the lesion, and thus, your cancer is unlikely to spread.
Okay, that is something good to hear.
However, what you have to keep in mind is that you have to pay attention and monitor your skin regularly. It is important to check for new or changing spots in your skin. A regular GP's checkup is highly recommended. I hope my explanation is clear to you.
Yes, it is. Definitely, I will follow your instructions. I now have a better understanding of what squamous cell carcinoma is. But nurse, I wonder, am I likely to need more surgeries to remove other lesions in the future?
Your question is appreciable. Perhaps it is beyond my scope of practice. So, I am not the authorized person for providing such information. Your GP, who has in-depth knowledge about your condition, is the best person to answer this. Kindly clarify your concern with him.
It's all right. No problem.
By the way, Mihiraa, I would like to know your habits when in the sun.
Nurse, these days, I always wear factor 30 sunscreen, or higher, and I also wear a hat when out in the sun. However, I think it's too late, because the damage has already been done.
Your current practice is absolutely necessary. Also, what you have said is a fact, and I too agree that some damage is historical. Nonetheless, I advise you to continue covering up in the sun, as it is essential to prevent further damage.
Of course, nurse. I will surely follow it.
I appreciate your understanding and willingness, Mihiraa. Well, how about your wound, post-surgery?
I am all right, nurse. I haven't been experiencing any complications so far.
Good to hear from you, Mihiraa. For confirmation, did you find any discharge from the wound?
No, nothing.
All right. So you are ready for the stitch removal. Isn't it, Mihiraa?
Nurse, I am a bit confused. Isn't it too early to remove the stitches?
Your thought is considerable. I will explain to you the reasons for the removal of stitches now.
Okay, you may please.
Mihiraa, typically the stitches are removed after 7 to 14 days. Since the doctor has assessed your wound and no other complications have been figured out, the doctor suggested the removal of stitches.
Okay.
Diagnosis done by the doctor will be the favorable way for your wound to heal.
Yes, I got it.
That's perfect. Mihiraa, you have to follow some wound care management after the stitch removal. I will brief you on that.
All right.
It is very important to keep your stitch wound clean. When going out, keep it covered and dry. This will help to heal the wound faster and with no chance of getting infected.
I understand that.
Mihiraa, do I need to address any more queries?
No, nurse. I am good.
All right. Can I have your consent to have the stitches removed, please?
Sure, nurse. You can remove the stitches.
Thank you for your consent, Mihiraa.
That is the end of your oat-speaking roleplay. All the very best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.